Did you know that 20% of adults worldwide are addicted to a substance that is legal in most countries? Today, we're diving into the history, impact, and ongoing battle with one of the world's most addictive substances, tobacco. From its ancient origins to its modern-day controversies, we'll explore how this once revered plant has evolved into a global health crisis. Do you smoke? Nicotine, found in cigarette smoke, is highly addictive, which is why it is medically classified as a drug. The World Health Organization also designates tobacco as a drug. Of course, some countries classify tobacco as a recreational product. But tobacco is more addictive than marijuana, and its addictiveness is on par with other drugs. Moreover, it causes various cancers, cardiovascular diseases, and cerebrovascular diseases. In 2015, a study by a research team at King's College London found that smoking increases the risk of developing mental illness by 3 times. However, there is no one who smokes without knowing this. People smoke despite knowing it. According to the latest data from WHO, 20% of adults worldwide are smokers, making tobacco an all-too-familiar drug-laced recreational product for us. How did humanity come to smoke tobacco? The history of tobacco is older than we might think. Records show that tobacco was first discovered by the indigenous peoples of Mesoamerica and South America around 6000 BC. Native Americans were absorbing nicotine by inhaling tobacco. Smoke or chewing leaves thousands of years before any recorded history, during the time when mammoths roamed the earth. The Maya people of Central America used tobacco in religious rituals and as a treatment for illnesses like asthma, fever, and burns. Tobacco began to spread worldwide after Columbus discovered the Americas in 1492. Columbus and his crew, being Christians, disliked tobacco and threw the dried leaves they received from the natives into the sea on their way back to Europe. However, some of the crew members were curious. Rodrigo de Jerez and Luis de Torres are known as the first Europeans to smoke tobacco. Moreover, after returning home from the expedition, Rodrigo was imprisoned for 7 years for smoking in public. Pope Clement VIII threatened to excommunicate anyone who smoked in sacred places. King James I of England banned tobacco in 1604. The first Tsar of the Romanov dynasty in Russia enforced such strict tobacco bans that he ordered the lips of smokers to be cut. In early Europe, tobacco was considered the devil's smoke and was viewed negatively. Had this continued, tobacco might not have spread worldwide. However, as other sailors who had visited the Americas began to smoke, tobacco started spreading like a trend in both Spain and Portugal. From the mid-16th century, tobacco seeds were imported into Europe. And by the late 16th century, tobacco use had become widespread in most European countries, with tobacco factories being established in each country. It was during this period that tobacco became a recreational product for humanity. While the harmful effects of tobacco are well known now, back then, many doctors claimed that tobacco had medicinal properties. Among them, the Spanish doctor Nicolas Menards even wrote a book claiming that tobacco could cure 36 types of diseases. Furthermore, in 1612, the first successful cultivation of tobacco occurred, and its spread accelerated. John Rolfe, an English merchant known for being the husband of Pocahontas, successfully cultivated tobacco in large quantities in Jamestown, Virginia, and began exporting it to England, making a fortune and turning Virginia, which was on the verge of collapse, into one of the most important colonies. However, the colonists alone were insufficient to cultivate large quantities of tobacco. It was at this time that many African slaves were brought to North America and began working on tobacco farms. This is one reason why tobacco is seen as a medium that adopted the institution of slavery. By 1700, tobacco production had become a major industry in Europe and its colonies. In the late 19th century, a machine that automated tobacco production was invented in the United States, significantly increasing production and allowing the tobacco industry to grow. Additionally, thanks to automated machinery, the price of tobacco dropped, making it a widely available recreational product. It was around this time that the tobacco industry began to grow, centered in the United States. However, there was still divided opinion among scholars about the dangers of smoking. It wasn't until the early 20th century that reports on the dangers of smoking began to appear in scientific and medical journals. In 1930, researchers in Cologne, Germany, discovered a statistical correlation between cancer and smoking, and 8 years later, Dr. Raymond Pearl of Johns Hopkins University published findings that smokers do not live as long as non-smokers. Meanwhile, the American Cancer Society stated as late as 1944 that there is no conclusive evidence that smoking causes lung cancer. But they still began to warn about the side effects of smoking. After extensive research on the effects of tobacco was conducted and the link between smoking and lung cancer was established, an official report, the Smoking Report, was finally released, stating that smoking causes lung cancer, throat cancer, and chronic bronchitis. As a result, the following years tobacco sales decreased for the first time in 20 years. However, the tobacco industry and tobacco companies had become too large. The method tobacco companies chose was marketing the so-called healthy cigarette marketing. It was during this time that filters were introduced. Tobacco companies invested vast sums in marketing by reducing tar content and developing cancer prevention filters. One of the major tobacco companies, Lorillard, developed its own filter, and the material used for this filter was crocidolite, a substance hailed as the miracle material. Crocidolite is composed of fine particles and was once used as a material for heat-dissipating agents and household products. It is resistant to friction, non-flammable, and non-conductive, allowing it to be used to create thin, durable products. However, crocidolite has another name, the silent killer, also known as asbestos. As discussions about the link between tobacco and cancer emerged and smoking rates declined, an asbestos filter was introduced under the name cancer-preventing filter. Of course, at the time, it was not known that asbestos could cause cancer. Lorillard, named after its then-president Herbert Kent, released a cigarette with an asbestos filter under the brand name Kent. Lorillard promoted it with the marketing claim, Kent's unique filter prevents all harmful substances in tobacco, including cancer, from entering your body. And it tastes great. For smokers, a healthy cigarette must have seemed like a gift from the gods. Not only did smokers flock to it, but even people who had quit smoking for health reasons returned to Kent. At that time, cigarettes were also recognized as a fashion statement for men and were marketed as one element of a sexy male image. Tasty, stylish, and with no health concerns, there was no reason not to smoke. Simultaneously, tobacco companies used celebrities in their marketing. They introduced premium lineups featuring filtered cigarettes and low tar, and even movie stars like Ronald Reagan, as well as politicians and doctors, appeared in advertisements claiming, "This is a good cigarette." Then, the companies came up with another idea: feminism. From the early to mid-20th century, the feminist movement was actively taking place in the West. In the early 20th century, there was a negative view of women smoking, but if women's smoking could be promoted, it would double the potential customer base for the companies. So, American Tobacco recruited Edward Bernays, a pioneer of marketing. He was one of the 100 most influential Americans of the 20th century and the founder of the first PR agency. One of Bernays' representative marketing strategies involved bacon and tobacco. In early 20th century America, people preferred simple breakfasts. Through a simple survey of internists, Bernays published an article stating, "Internists prefer a hearty breakfast," thereby changing perceptions. At the same time, to promote the sales of bacon, which was not a popular breakfast item, he used other articles to explain that bacon and eggs are the ideal breakfast menu. With these two articles, the notion, "a hearty breakfast equals bacon," took hold, and now we have the image that a Western breakfast includes bacon and eggs. The marketing Bernays planned for the tobacco company was called the Torches of Freedom. He combined the idea of feminism advocating for equality with cigarettes. Bernays had young women march down the street smoking cigarettes. He appeared on a broadcast and stated, "The day women light cigarettes is like lighting the torches of freedom in the human rights movement." At that time, cigarette packages were green, but to evoke a favorable response to the color of the cigarette boxes, Bernays even influenced the fashion industry, popularizing the green color. All of these marketing efforts were hugely successful, and the tobacco industry flourished once again. However, this did not last long. Due to poor working conditions, people began dying of cancer and other diseases in tobacco factories. Moreover, as information about the harmful effects of tobacco became widely known, it became a societal issue. Additionally, the increase in nicotine addiction led to losses in labor force productivity and social security costs for the country. According to the Global Tobacco Use Trends from 2000 to 2030 report, released by WHO on January 16, 2024, the global smoking rate is currently declining. In 2000, it was estimated that 35% of adults worldwide were smokers, but that figure has now dropped to 20%. The report predicts that by 2025, the number of smokers will decrease to 1.2 billion. However, according to a paper published in the American Psychiatric Association Journal in 2020, although the smoking rate in the U.S. decreased for about 10 years from the 2000s, nicotine dependence actually increased. The association has proposed several hypotheses about this. According to these hypotheses, although the percentage of smokers has decreased, the nicotine dependence of those who cannot quit smoking has worsened. It is said that nicotine dependence increases the longer one smokes, the older one gets, and the more socioeconomically unstable one is. So, the conclusion this time could well be, let's quit smoking. This has been a discussion about tobacco, a substance to which 20% of adults worldwide are addicted. Thank you for watching. Don't forget to like, comment, and subscribe for more insightful content. Take care and see you in the next video. Goodbye.